5-step EKG rhythm analysis checklist. 1. Rate. Calculate heart rate, beats per minute, BPM. Count number of R waves in a 6-second strip, 30 large boxes, and multiply by 10. Alternatively, count large boxes between 2 R waves and divide 300 by that number, e.g., 4 boxes equals 300 divided by 4 equals 75 BPM. Classify rate, less than 60 BPM, bradycardia, e.g., sinus bradycardia. 60 to 100 BPM, normal, e.g., normal sinus rhythm. 100 BPM, tachycardia, e.g., sinus tachycardia, atrial fibrillation, ventricular tachycardia. Variable rate suggests irregular rhythms, e.g., atrial fibrillation, multifocal atrial tachycardia. Note: for irregular rhythms, average the rate over multiple beats. 2. Rhythm. Determine if rhythm is regular or irregular. Measure RR intervals using calipers or paper edge. Consistent RR intervals equals regular, e.g., sinus rhythm, ventricular tachycardia. Variable RR intervals equals irregular, e.g., atrial fibrillation, premature ventricular contractions. Check for patterns. Regularly irregular, e.g., atrial flutter with variable block, bigeminy in PVCs. Irregularly irregular, e.g., atrial fibrillation. 3. P-waves. Identify P-wave presence and morphology. Present before every QRS? Normal shape, upright in lead 2, smooth, less than 0.12 seconds? Yes, suggests sinus rhythm or atrial-driven rhythms, e.g., sinus bradycardia, sinus tachycardia. Absent or replaced by fibrillatory/sawtooth waves. Fibrillatory waves, atrial fibrillation. Sawtooth pattern, atrial flutter. Inconsistent or missing before some QRS complexes? Suggests PVCs or premature atrial contractions, PACs. Note P-wave to QRS ratio, e.g., 2:1 in atrial flutter with 2:1 block. 4. QRS complex. Measure QRS duration and morphology. Narrow QRS, less than 0.12 seconds, less than 3 small boxes. Supraventricular origin, e.g., sinus rhythms, atrial fibrillation, atrial flutter. Wide QRS is greater than or equal to 0.12 seconds. Ventricular origin, e.g., ventricular tachycardia, PVCs, or conduction delay, e.g., bundle branch block. Check consistency. Uniform QRS shape suggests single focus, e.g., VT, sinus rhythm. Varying QRS shapes, multifocal PVCs, or aberrancy in atrial fibrillation. Look for compensatory pause, common in PVCs, or fusion beats, suggests ventricular rhythms. 5. T-waves. Assess T-wave morphology and consistency. Normal, upright in most leads, smooth, follows QRS. Abnormal, inverted, peaked, or biphasic, may suggest ischemia, electrolyte imbalances, e.g., hyperkalemia, or post-arrhythmia changes. Check for T-wave alternans, alternating amplitude. May indicate instability in ventricular tachycardia. Ensure T-waves follow QRS complexes consistently, absent in ventricular fibrillation. Additional checks. PR interval, if P-waves present. Measure. Normal 0.12 to 0.20 seconds, 3 to 5 small boxes. Prolonged, greater than 0.20 seconds, first degree AV block. Shortened, less than 0.12 seconds, pre-excitation, e.g., WPW syndrome. Variable, second degree AV block or atrial fibrillation. Artifact check. Confirm no loose leads, patient movement, or electrical interference mimicking arrhythmias. Correlate with patient. Assess symptoms, palpitations, dizziness, chest pain, and vitals, BP, oxygen saturation. Review history, heart disease, meds, electrolytes, to identify arrhythmia triggers. Common arrhythmias quick reference. Sinus bradycardia, rate less than 60 BPM, regular, P-waves present, normal QRS, normal T-waves. Sinus tachycardia, rate greater than 100 BPM, regular, P-waves present, normal QRS, normal T-waves. Atrial fibrillation, rate variable, 100 to 180 BPM, irregularly irregular, no P-waves, fibrillatory waves, normal QRS. Atrial flutter, rate 250 to 350 atrial, ventricular varies, regular/irregular, sawtooth flutter waves, normal QRS. premature ventricular contractions, PVCs, sporadic wide QRS, greater than 0.12 seconds, no preceding P wave, compensatory pause. Ventricular tachycardia, rate 150 to 250 BPM, regular, wide QRS, no P waves, T waves often obscured. Ventricular fibrillation, chaotic, no discernible waves, no measurable rate or rhythm. Future nurses, love these NCLEX tips? Subscribe, hit the bell for daily drops, like, and share with your study group.